What is movement disorder? Definition. What is a movement disorder? Refers to a group of nervous system or neurological condition that cause abnormal increased movements which may be voluntary or involuntary. Movement disorder can also cause reduced or slow movements. Movement disorder can be classified in many ways, but at your level, the simplest way of classification of movement disorder is projected over here. The most common movement disorder in elderly patients is Parkinsonism, hyperkinesia, ataxia, spasticity. Hyperkinesia again subdivided into tremors, dystonia, myoclonus, tics, and chorea. One by one, we will discuss all these movement disorders, and uh, in after a few slides, we will see the pictures of these movement orders. What are the ataxia? Ataxia uh, basically due to the problem in the cerebellum. As we know, the cerebellum is uh, basically control the uh, balance of the body. So when this is, cerebellum is diseased, so there will be the uncoordinated movement and clumsy balance, speech or limb movement, and other symptoms. Cervical dystonia. This condition causes long-lasting contraction or spasm or intermittent contraction of the neck muscle, causing the neck to turn in different ways. Chorea. Chorea is characterized by repetitive, brief, irregular, somewhat rapid involuntary movement that typically involve the face, mouth, trunk, and limb. Can anybody tell me which systemic disease is which systemic disease uh, is associated with Korea? Rheumatic fever. Good, good enough. It is a major criteria of rheumatic fever in which chorea is present, and if chorea is present in the rheumatic fever and other major criteria is not met, neither the major nor the minor, and only chorea is present, the rheumatic fever diagnosis will be established on the basis of chorea. And in rheumatic fever, chorea is predominant in females. Multiple system atrophy. Multiple system atrophy, as the name denotes, it involves the multiple system like bladder, like blood vessels, and nervous system. This is very uncommon progressive neurological disorder which affects many brain systems, and it causes atrophy which causes movement disorders such as ataxia or Parkinson's. It also causes low blood pressure and impaired bladder function. Myoclonus. This condition causes lightning quick jerks of a muscle or a group of muscles. Parkinson's disease. This is the common disease of the elderly patient, usually, not necessarily, usually in male patient, and it is due to the basal ganglia lesions, basically basal ganglia disease, and it is slowly progressive neurodegenerative disorder which causes tremors, stiffness or rigidity, slow decreased movement, bradykinesia or imbalance. It may also causes other non-movement symptoms. Progressive supranuclear palsy. This is a very rare neurological disorder that causes problems with walking, balance, and eye movement. It may resemble Parkinson's disease, but it is a distinct condition. Restless leg syndrome. Restless leg syndrome usually occurs at night time or during sleep. This movement disorder causes unpleasant abnormal feeling in the leg while relaxing or lying down, often relieved by the movement. Tardive dyskinesia. This neurological condition is caused by long-term use of certain drugs used to treat psychiatric conditions, neuroleptic drugs. Tardive dyskinesia causes repetitive and involuntary movement such as grimacing, eye blinking, and other movements. Rorty syndrome. This is a neurological condition which starts between childhood and teenage years and is associated with repetitive movements, motor tics, and vocal sounds. Tremors. This movement disorder. This is very common condition, movement disorder, and many a times it comes not only in a neurological OPD, but it can also come in the medical OPD as well. This movement disorder causes involuntary rhythmic shaking of a part of the body, such as the hand, head, or other part of the body. The most common type is essential tremor. Wilson's disease. This is a rare inherited disorder that causes excessive amounts of copper to build up in the body, causing neurological problems. Dystonia. This condition involves sustained involuntary muscle contractions with twisting, repetitive movement. Dystonia may affect the entire body. Generalized हो सकता है या focal dystonia हो सकता है जिसमें part of the body जो है वो affect होता है. Functional movement disorder. Functional movement disorder may there is no organic lesion in the brain or somewhere else, but patient have some psychogenic element and patient is having the movement disorder. Huntington's disease. This is an inherited progressive neurodegenerative disease disorder which occurs in the middle age group and causes uncontrolled movement like chorea, impaired cognitive abilities, and psychiatric conditions. At this point, if you have any query, any question, you can ask me. Then we will go on with the pictures and sign and symptoms. Till now, are you people with me, or you want to ask something which is not clear to you? Uh, Binish said, what is the difference between the myoclonus and the dystonia? Binish, when we go with the pictures, you will very easily differentiate with the dystonia and the myoclonus. Myoclonus is like the twitching of the muscle. Twitching of the muscle is myoclonus, and whole body uh, posture change is dystonia. I will show you the picture of dystonia, then you will understand it clearly. Should I go on? Okay, thank you. Dystonia. Dinesh, you and your classmate can easily see that the posture, whole body posture of the patient is weird in dystonia. Patient is dragging his leg. There is involuntary pulling of the neck. Patient experiences cramps of the foot. Patient finds difficulty in the speech, uncontrollable blinking. Patient feels pain and is exhausted all the time. Stress and fatigue triggers the symptom of the dystonia. While in the myoclonus, the one or two muscles are only involved, and the whole body posture remains the normal. Sometimes even myoclonus can be uh, cannot be appreciated by the patient as well as the physician. Ataxia. Again, in this, I am damn sure कि आपने ataxic gait के patient देखे होंगे. In previous slide, I have told that ataxia is basically due to ataxia is due to the disease of the cerebellum, and the cerebellum controls the balance of the body. So, due to the ataxic gait, what is ataxic gait? Lack of proper coordination, unsteady gait with the potential to stumble and fall, frequent falling episodes, lack of muscle coordination in the legs, and ambulation difficulties. These are chorea. Chorea. Chorea may be of simple upper limb abnormal movement, or lower limb abnormal movement, or whole body abnormal movement of the chorea. This is the classic book picture of the Parkinson's disease. The posture of the Parkinson's disease is called the stoop posture. The patient is bending forward and he had a he had a masked face and he is tilting his trunk forward. There is a reduced arm swing. Patient had hand tremor, which is known as pin rolling tremor. Patient has slightly flexed knees and if patient gait was short and shuffling, there is flexed elbow and wrist. Patient had rigidity, which is lead pipe rigidity, basically lead pipe rigidity. Patients of Parkinson's disease are never demented. If patient is become demented, so you have to revise your diagnosis. This is tardive dyskinesia. Different part of the body abnormal movement. Rolling of the tongue in slide D, in part F, there is the abnormal contraction of the neck as well as mouth. In part C, there is a abnormal movement of the tongue, and so on so far. Tremors. Tremors are there are a lot of examples of the tremor. Tremors can be tremors can be physiological. How can it be physiological? Maybe you all or maybe some of you can feel the tremors. जैसे जब हम एग्जाम्स के लिए जाते थे, मैं अपनी बात करूंगी, जब हम अपने एग्जाम्स के लिए जाते थे स्पेशली वाइवा के लिए, तो हमारे हाथों में ट्रेमर्स होते थे और हाथ बहुत स्वेटी हो रहे होते थे कि पता नहीं एग्जामिनर क्या पूछेगा क्या नहीं पूछेगा. तो दीज आर द फिजियोलॉजिकल ट्रेमर्स. उसके अलावा ट्रेमर्स एंडोक्राइन कॉजेज में भी होते हैं लाइक थायरोटॉक्सिकोसिस में. इसके अलावा ट्रेमर्स जो है आपके पास सेरिबेलर की कोई भी लीजन हो उसके अंदर होते हैं, पार्किंसंस डिजीज के अंदर होते हैं, पिन लोडिंग ट्रेमर्स, सो ऑन सो फॉर. इसके अलावा पेशेंट विल्सन्स डिजीज का पेशेंट आता है, उसके साथ भी जो है आपके ट्रेमर्स आ सकते हैं. कुछ ड्रग्स होती हैं जो कि ट्रेमर्स को प्रोन करती हैं, सो ऑन सो फॉर. Again, till now is there any question, कोई query आपकी हो तो you are more than a welcome. I will answer your queries. Binish, I think you are now you are clear the difference between the myoclonus and dystonia. Pin rolling tremors. पार्किंसंस के जो ट्रेमर्स होते हैं वो पिन रोलिंग ट्रेमर्स होते हैं. एटेक्सिया, रीवा मैंने आपको बताया कि एटेक्सिया इज basically caused by anything, either infarct, a space occupying lesion, or hemorrhage in the cerebellum, anything, any disease which causes disturbance in the cerebellar function is called ataxia. Okay. How can we diagnose? Diagnosis is basically clinical. जब भी पेशेंट आपका ओपीडी में या क्लिनिक्स में आ रहा होता है या वार्ड में होता है, तो जब आप पेशेंट अगर आपका चल के आ रहा है या पेशेंट आपका बैठ कर व्हीलचेयर बाउंड है या बैठा हुआ है, तो उसमें पेशेंट को आप जब देखते हैं तो आप देखते ही पहचान जाते हैं कि जो है ये पेशेंट बेसिकली किस किस कैटेगरी में फॉल कर रहा है, एक एग्जिट गेट है इसका या क्या है। तो बेसिकली तो पेशेंट आप क्लिनिकली असेस कर चुके हो। बाकी जो है श्योर शॉट होने के लिए आप अगर कराना चाहें तो ट्रेमर आप जो है वो इमेजिंग कराते हैं, जिसमें आपको अगर विल्सन्स हैं तो कॉपर की डिपोजिशन नजर आ जाती है, अगर पार्किंसंस हैं तो बेसल गैंग्लिया का लीजन नजर आ जाता है। ये टैक्सिक पेशेंट है तो एमआरआई करा लेते हैं, तो जो है वो सेरिबेलार के लीजन आपको नजर आ जाते हैं। इसके अलावा जो भी आप चीजें सस्पेक्ट कर रहे होते हैं, उसी विल्सन अगर आप सस्पेक्ट कर रहे हैं तो यूरिनरी कॉपर भी आप करा सकते हैं। ट्रेमर्स अगर आपको ऐसा लग रहा है कि जो ये ट्रेमर्स हैं, तो जो है उसके लिए आप थायरोटॉक्सिकोसिस के लिए वर्कअप करा सकते हैं। कोरिया अगर आपको लग रहा है रिमेटिक फीवर है, तो आप उसके मेजर माइनर क्राइटेरिया के अलावा इको भी करा सकते हैं, ईसीजी करा सकते हैं। सो इट डिपेंड्स कि what type of movement disorder you are suspecting in this patient, in your patient. Same for the treatment. Treatment of the cause. What is the cause? According to the cause, you will treat the patient, and in movement disorder, the treatment and rehabilitation is very important. More important is rehabilitation and counseling of the patient and attendant rather than the treatment. ट्रीटमेंट बहुत ज़्यादा इफेक्टिव होती नहीं है, लेकिन आपके पास जो रिहेबिलिटेशंस होती हैं, जो काउंसलिंग्स होती हैं, वो आपके पास ज़्यादा इम्पोर्टेंट होती हैं। इट्स ऑल फ्रॉम माय साइड। अगर आप में से किसी को कुछ पूछना है तो आई एम हियर टू आंसर यू।